Hello everyone, myself Dr. Rahila Jan. I welcome you all on YouTube channel DentoMac Dental. Today we will discuss about tooth fracture. Let's get started. As we know, the tooth is divided into three main parts. The three tissues, the enamel, the dentine and the pulp. A fracture is a break or crack in the hard shell of the tooth, which is the enamel, and which protects the softer inner pulp of tooth that contains nerves and blood vessels. Depending upon the type of fracture, the tooth may not cause any problem or it may cause pain due to the fracture. Types of tooth fracture include: first type is the craze lines. These are the shallow cracks that cause no pain and require no treatment. Second one is the fractured cusp, that is the break in the chewing surface of the tooth. Third one is the cracked tooth. The tooth cracks from the chewing surface down towards the root of the tooth. Fourth type is the split tooth. That's the cracks down to the root, separating a section of the tooth. Fifth type is the vertical root fracture, which is the cracks which begin in the root and move up towards chewing surface. Now we will discuss on the causes of the tooth fracture, or which may cause the fracture of a part of the tooth. That is, the cause may be chewing on hard foods or accidentally biting down on hard objects can lead to crack in the tooth. Other factors may include teeth with current tooth decay, teeth that have been restored with amalgam alloy or silver alloy, teeth that are exposed to temperature extremes within short periods of time. The fractured tooth may show the symptoms like pain with chewing, sharp pain when you bite down, pain with cold or hot air or cold or hot food, except the vertical root fracture, which may not be noticed until a bone or gingival infection may develop. After examining the tooth, the diagnosis is made. First, we should ask the symptoms and when and how did it happen. And to help to locate the fracture, the following methods are used commonly, like dye staining. It's used to see the cracks in the tooth. Transillumination. This is the passing the light through the tooth, which will help us to locate the cracks, either by periodontal probing for looking the extent of the cracks. Bite test. Patient is asked to bite down on a stick, or we should use X-ray to locate the defects which may not be visible with the naked eye. Now coming to the treatment plan of the fractured tooth. The treatment will depend solely on the severity of damage to the tooth. First option is the crown. A temporary cap is placed over the tooth at first to make sure it corrects the problem. A permanent crown will be eventually placed. Second option is the veneer. A thin covering is placed over the tooth if there is small chip in the surface. Third option is the RCT, which is a root canal treatment. If there is severe damage to the pulp, the root canal treatment may be performed. Fourth option is the tooth extraction. If crack extends below the gingival line, the tooth may be extracted. Fifth option is the removal of the fractured portion only, which is possible and performed in the vertical root fracture. Thank you guys. Gari Ruju, Salamat Ruju. Stay home, stay safe.